If you keep sliding forward in your wheelchair, scooting back, readjusting, and all to slide down again, ending up slumped over with lower back pain, neck pain from holding your head up all the time, this is not a willpower issue. This is not necessarily a your body issue. This possibly could be a wheelchair setup issue, and that's great news. Because if it's a problem with the wheelchair, that's something that you can identify and fix. In this video, we're going to go through 5 main issues for that. But before we do, my name is KJ Phillips. I'm an ATP SMS for over 10 years, and welcome to Adaptive Solutions. This channel is made to help wheelchair users, their caregivers, and clinicians understand why these problems happen so that you can ask better questions and get better outcomes. It's part of my life's overarching mission to improve people's lives through high quality, reliable information at no cost to them. Let's get to it. Sliding in your wheelchair is caused by one main factor, and it's relentless: gravity. There's going to be other reasons as well, but the reason everybody eventually slides forward is that gravity never stops pulling on you. So the question is, what can your wheelchair do to help slow that down? Number one, your seat to back angle. In wheelchairs, both your seat can be angled and your backrest can be angled. Both of them can be adjusted to help you delay sliding. But first, to understand that, let's look at the other side of how they can make sliding out of your chair even easier. Think of sitting in something where it's just obvious, like a beach chair. The seat's flat, the backrest is way back. It's basically a slip and slide for you to slide right out of. So now that you kind of get the idea of what you don't want, here's how you change those to get what you do want. First things first, you can close your back angle. Most people don't do this because they feel they're sitting too upright. And so, because they don't understand the difference between tilt and recline, they will recline their chair recline their chair backwards enough to where they feel like they're not going to fall forward out of the chair. But here's the thing: you do that with your tilt angle instead. So, for chairs that tilt, like manual wheelchairs or powered wheelchairs, instead of opening up your recline, actually tilt the chair back. This will help reduce the feeling that you're tilting forward out of the chair, and at the same time you're creating a bit of a slope, or sometimes called seat dump, that makes it harder for gravity to just slide you right out of the chair. If you're in a manual chair, maybe like a rigid or a folding manual chair, this same adjustment can be done, though it's not as quick as chairs that are meant to be tilting and reclining many times throughout the day. But you can adjust the front seat to floor height and rear seat to floor height to effectively build in some dump into your chair. That way, you can have less of an open back angle, tuck that in, and then just tilt the whole chair back a little bit. With that, you create bucket. Really, most chairs, even able-bodied people that sit in chairs, most of the chairs I sit in are not flat. They're built with some of this angle. Factor number 2, friction, or the lack of friction, can absolutely make it easier to slide. And so how do you use friction to your advantage? Think about what's between you and your cushion underneath you. Is your cushion cover slick? Plenty of people also have something like a Hoyer sling sitting underneath to make transfers easy. Well, guess what? You just put a low friction surface in between you and your cushion. So when gravity is pulling you, it's even easier to slide forward out of your chair. Aside from just a Hoyer sling, people leave incontinence pads underneath, or maybe even just wear basketball shorts. All of these things create the same effect, which is little friction between you and your seat cushion. It's going to make sliding forward much easier to happen. So, in an issue like a Hoyer sling or an incontinence pad, what do? People have them there for a reason. Well, depending on your environment, like for the Hoyer sling, it may not be up to you or a family member. If you're watching this and you have a family member that's in like a nursing home where they always leave the sling underneath them. But if you're at a place where you have control, you can actually buy a split leg sling. It's about $80 to $100, and that makes it much easier to take in and out this sling instead of leaving it underneath them constantly. And there's other issues with leaving a Hoyer or an incontinence pad underneath. We'll go into those in another video. With the incontinence pad, people often leave it underneath the patient for easy cleanup, which I understand. And at this point, you have two competing goals. I want to clean up accidents easily. And my second goal, I don't want to be falling out of the chair. So you need to figure out which one's the most important. At the very least, you could have a cushion cover that has incontinence proof lining. So that way, if there is an accident and it's not a big accident, you can wipe off or wash the cover. That way, you don't have such a low friction surface in between you and your cushion all the time. All right, factor number three, we're going to get more into the little bit of technical side. The contour of your cushion also helps or hurts your ability to stay in your seat. We've talked a bit about having a seat dump by raising the front of your wheelchair. Well, guess what? Cushions also have that kind of feature built into it. There are cushions that have a thicker front end so that effectively you're making this bucket in your chair. Aside from just a thicker front end, some of them even build like a shelf, like a discrete step function into the cushion itself, so that when you slide, your bottom will eventually hit that shelf and it's much harder to keep sliding forward. That's called an anti thrust shelf. Some cushions have it. It's not super common, but that's one thing you could have. Something else that kind of combines what we've talked about before and fits into this category is friction. You could have a cushion cover that's super slick and lets you slide right out, or there are some cushions that instead go the other way. They actually have high friction cushion covers that, when you combine with something like a seatbelt and good posture support all around, actually keep you in place. They up the amount of friction so that it's harder for gravity to pull you out. Number four, look at what's below your pelvis, your foot support, your seat depth. Your feet are part of what holds your position. And if your seat is too short or if the foot plates are like way too low, then think you have weight that's hanging down off the front of the cushion. That unsupported weight will drag you forward. And when your feet dangle, your body is going to keep sliding until that weight gets supported. Those of you that don't have foot plates might recognize that this just happens all the time. And if you can't load weight on your feet, this is just something you have to live with. A little side note, the opposite problem of having too long of a seat actually causes the same postural issue, posterior pelvic tilt. When you can't scoot your butt all the way back to the backrest with the back of your pelvis, your PSIS, posterior superior iliac spine, you end up sitting in that same slumped posture because as soon as you sit down, your pelvis will tilt back. It's the same problem, except you're not even sliding to get to that position. You just start there. Same bad posture, just a different cause. For more on that, watch one of my first videos. I think it's called Scoot Your Butt Back. It's one of the things I tell patients the most of anything else. Lean forward, scoot your butt back. It's so common that I made my first video about that. All right, number five, this one's tricky and subtle, but makes such a key difference. It's your seatbelt angle. If your belt is mounted and anchored at the very back of your wheelchair seat frame at about a 45-degree angle to your hip, it's very easy to slide right through it. Why? Because you have wrapped your seatbelt around the widest part of your hip. It's kind of simple. And so there's really nothing stopping you from sliding through. But if you move that anchor point so that the seatbelt rests at a 60 to 80-degree angle instead, then once it's buckled and snugged, then the belt should sit right at the crease where your thighs meet your torso when you sit. The more technical term is it should sit below your ASIS, the anterior superior iliac spine. In case you're curious, that's a little bony part on the front of your pelvis, and your PSIS is the bony tip on the back of your pelvis. Now that the belt is around a narrower part than your hips, it's actually much harder to slide forward when that belt is snug. It sounds like a small change, but it makes a huge difference. Why this matters? It's not just about comfort. When you keep sliding into a posterior pelvic tilt all day and stay there, especially after you get tired enough that you don't keep fixing your posture all the time, that postural deformity is going to travel up your spine. It makes changes. It drives the progress of scoliosis faster. When your lower lumbar and thoracic spine curve, your shoulders will pronate forward. So for manual wheelchair users, that's going to make it harder to push. For all wheelchair users, it's going to make it harder to lift your arm, grab things. And for everybody as well, when you have pronated shoulders and a kyphotic upper spine, it's going to make your head hang forward, which means your neck muscles are putting in more work to hold your head up. Why? Because the further forward your head sits from its base. In other words, when your spine is straight, it's stacked on top of your spine, takes minimal energy to hold your head up. The further your head comes forward, the heavier your head will feel and the more muscles and energy it takes to actually hold your head up. It's like exponentially heavier. It makes a big difference. And it's aside from even just the posture issues, sliding is important because when you slide, there are shear forces on your body. What is shear? Shear is a little different from pressure on its own. It's when your skin is being pulled one way while the bones underneath are being moved the other way. If you think of the little cells and blood veins, when you sit down, a lot of the times they get kind of compressed and squished. Think of like a hose being squished. When you have shear forces, the shear is more like rolling, kinking, and twisting the hose, twisting those cells and veins. It's much more damaging to the tissue. And if you want to hear more about that, I have a video called What the Bleep Are Pressure Wounds. It's one of my first videos as well. Really interesting stuff. So that's one of the main ingredients for pressure wounds is shear forces. It's so much easier to damage your tissue. Once that tissue is damaged, it will not be as resilient as it was before. So repeated sliding isn't just about the annoyance of getting back into position all day. It causes postural deficits and real health risks. It's worth taking seriously. In your life, if you have just now realized, hey, I do slide all the time and that's a problem I don't want to live with. Maybe it's getting worse or you have redness underneath your bottom. It's time to call and consult your medical and seating professionals. This video is helpful and educational, but it does not replace a one-on-one evaluation. This information is meant to help you realize what's going on and ask better questions so you can figure out what to do about it. If you do want a second set of eyes, I offer wheelchair pain and positioning consultations. You can send your photos, your setup, a description of your symptoms, and we can have a call to identify the likely contributors so I can take a look at what's going on in your chair and give you recommendations to bring to your seating team in person. The link to my website is in the description, or you can email me directly at info@getadaptivesolutions.com, spelled just the way it shows up on the screen. Thank you so much for your time and attention. We're going to keep going down the list of 5 reasons that your wheelchair doesn't fit, and subscribe so that you don't miss the next one.